In Fox 5 Health News, scientists may have pinpointed the area of the brain responsible for chronic pain, paving the way for new treatments.
All right, joining us now, Dr. Serge Sugger, Chief of Infectious Diseases at Holy Name. So tell us exactly what this found and what the potential ramifications of this discovery could be.
Sure. So thanks, guys. This is really revolutionary. It's a very small study. Let me preface with that. A little background. 1 in 5 Americans experience chronic pain. Chronic pain doesn't mean when you stub your toe and you say, ouch. Chronic pain is something that goes on for a year or longer. And oftentimes, as a physician, when I ascertain if someone has pain, we ask them, on a scale of 1 to 10, what is your pain? They give us a subjective reading. But that's not always accurate. So this new study that was recently published in Journal of Neuroscience looked at 4 different individuals, all who had chronic pain, so pain longer than a year. One had what we call phantom pain after an amputation. The other 3 had chronic pain after having a stroke. And what they found essentially is, after using electrodes, that the same part of the brain, the frontal occipital cortex, lit up every time. And so what they're saying is that maybe this is an objective biomarker that, A, we can use to diagnose people with chronic pain. Especially oftentimes think about children or those that may be medically or mentally incapacitated, may be unable to verbalize that they're having chronic pain. So 1, it's a biomarker for chronic pain. And 2, it's a theoretic area of therapy. Maybe you can use electrodes to disrupt the brain waves coming out of that part of the brain and break the cycle of this chronic pain. Now, again, it's a very small study, only 4 patients, but if it can be collaborated with larger studies that follow patients for longer periods of time, then really it would be revolutionary in terms of how healthcare providers that deal with chronic pain, pain management specialists, really approach pain. So it's very exciting, very preliminary initial study, but again, an objective, potential objective biomarker, not only for diagnosis, but for also offering therapy. And again, 1 in 5 Americans, 20% of Americans, who deal with this very
that'd be great. Not everyone would wind up getting addicted to opiates trying to deal with the pain. That would be a huge breakthrough for sure.
Yeah. All right, Doctor, well, experts are recommending kids as young as 4 learn life-saving techniques like dialing 911 and CPR. Talk about why it's so important for kids to learn this at that age.
Sure. So, of course, anyone initially listening may say, a 4-year-old, what are you talking about? But remember, the time of survivability involves seconds. And the vast majority of cardiac arrests, when the heart stops beating, when people stop breathing, occur outside the hospital. When we deal with these code blues or rapid responses in the hospital, thanks to modern technology, we're much better at getting those patients back and having a better chance of survival. However, contrast that to what oftentimes happens. People have cardiac arrest at home. That's why it's so important that the common person, that is someone who is not a medical professional, but anyone can learn basic life support, chest compressions, rescue airway breathing. And the thought here by the American Heart Association, and others, is that if you introduce this concept early in children, as young as 4, to at least call 911, and then teach them in elementary school and middle school, then by the time they're 10 or 12 years of age, they can at least offer basic life support, chest compressions, rescue airway breathing. Think about it, sports games at gyms where we now have the automatic, we call AEDs, automatic defibrillators, that does not require any advanced medical knowledge. These seconds will save lives. These will improve survivability rates. It's really a ripple effect. Knowledge is power. Right. And so we can empower children at a very young of age to how to approach this. By the time they get a little bit older, they will be eager and willing to learn and perform BLS and save lives.
Yeah, and comfortable, too, to reacting
exactly.
also.
That's right.
Right.
All right, Doctor, thank you so much for joining us.